Yeah, what we've done today is a really unique simulation activity. It's essentially recreating an entire emergency department, and our students have to come in and look after their patients, working with the nursing staff, working with supervising doctors, having to fill out the paperwork, having to request the tests, and most of all, having to talk with their patients and help them, whether it's with pain relief or making a diagnosis or a whole range of other treatments.
So they're simulated patients in the terms of they're actors who come in, and it's very extensive. Like the patient that I saw, she came in with bruises, all like makeup and things, but they're very real and they're very emotional as well. So a lot of them break down in front of you, and it's really about how to cope with that situation and how to make them feel heard and, you know, cared for.
So today, the way that everything worked was essentially you walked in, and then there was a big notice board with all the patients' names on it, a bit like a triage, and you're allocated a patient and given the chart with all the different forms and said, you know, off you go. And so you have to go and, being the doctor, talk to the patient and assess them. So ask some questions and examine them. And then, you know, you've got the nursing staff all around you, so you need to coordinate with them and order tests, and then you need to present to your main, you know, your doctor who's supervising the patient and discuss with them what you'd like to do. And there were, you know, it was really detailed. This sim was fantastic because even if you wanted to order a test, you'd have to go to the pathology department with the form and, you know, ask them. Or if you wanted to admit a patient, you literally got on the telephone and called the number and spoke to the person on the other end, which was, you know, we've never done anything like that before. It's so real once you're in it.
Perhaps most of all, I think one of the things this does is it allows the students to reflect on their own strengths and weaknesses. This day that they come to perform their patient care, they get a real idea of, well, there's some things I can actually do here, and that's really good. But there's some things that are really hard, and they often cite things like the paperwork and having to look after multiple patients at once. So it almost serves as a bit of a needs analysis for them about where they need to go between now and when they're doing those clinical rotations.
So I've always wanted to be a doctor because interesting thing is you get to combine your knowledge based on the body and your sort of science knowledge, which I really enjoy learning about. But then you get to apply it to each different patient who are in themselves a sort of little puzzle that you need to solve, and then the reward at the end of it is, you know, you're helping people, you're potentially saving lives. So it's just the most amazing form of problem solving that you can think of, and that's what I really, really enjoy about it.